Hi, my name is Jomar Ali, and this is my presentation on stroke. The definition of a stroke. So, a stroke happens when the blood supply to part of the brain is cut off, causing brain cells to die. The importance of an early recognition is that this allows you to get quick treatment and allow you to save lives and reduce brain damage. So, let's get into the two major types of stroke. The first one is an ischemic stroke. So, an ischemic stroke happens when a blockage or reduced blood flow cuts off the blood supply to the part of the brain. And with this, oxygen and nutrients aren't able to reach brain tissues. And without oxygen, brain cells start to die within minutes. TIA, or transient ischemic attack, is better known as a mini stroke, which is caused by a temporary clot. The second type is a hemorrhagic stroke. So, a hemorrhagic stroke happens when a blood vessel in the brain breaks or leaks. This causes bleeding inside the brain, and the buildup of blood puts pressure on brain cells and leads to further damage. Let's go over the statistics of stroke. So, the fifth leading cause of death in the United States are strokes. Every 40 seconds, someone has a stroke. 1 in 4 survivors will have another stroke later on in the future, and 87% of strokes are ischemic strokes. This means that ischemic strokes are the most common stroke type, causes of stroke. So, blood clots. Blood clots are the primary cause of ischemic stroke. So, when clots form in the arteries that lead towards the brain, they constrict or block the blood flow, causing brain cells to die. The factors contributing to blood clot formation include atherosclerosis, where fatty deposits build up inside the arteries, burst blood vessels. So, burst blood vessels lead to hemorrhagic stroke. Conditions like high blood pressure weaken the blood vessel walls, making them more susceptible to rupture. This situation can cause bleeding inside the brain, leading to increased intracranial pressure and potentially fatal outcomes. High blood pressure. This is a significant risk factor for both ischemic and hemorrhagic strokes. It causes damage to blood vessels over time, increasing the chances of blood clots and vessel rupture. Regular monitoring and management of blood pressure through medication and lifestyle changes are crucial in stroke prevention. And there are ways to prevent strokes, and I'll be going over that later on in the presentation. So, heart disease. Irregular heartbeats can cause blood clots that travel to the brain and block blood flow, or directly affecting the brain's blood supply. Now, if you lead an unhealthy lifestyle, smoking, drinking alcohol, or you're not physically active, this increases blood clot formation and can damage your blood vessels. Let's move on to the symptoms of stroke. First, I want to go over the FAST method. So, the FAST method serves as a quick and effective way to identify the warning signs of a stroke. The acronym stands for face drooping, meaning one side of the face is paralyzed or going down, or it may appear uneven or droopy. Arm weakness. One arm may drift downward when both arms are raised simultaneously. Speech difficulty. The person may exhibit slurred speech or have trouble speaking clearly. Oftentimes, they will have a hard time trying to think or speak in a drunken kind of way. Lastly, it's time to call 911 or emergency services. If any of these symptoms occur, immediate medical attention is crucial. Some additional symptoms, in addition to the fast signs, include sudden confusion, difficulty understanding speech, blurred or decreased vision in one or both of the eyes, dizziness, loss of balance or coordination, as well as a severe headache with no known cause. Recognizing these symptoms and being able to respond quickly can significantly impact recovery outcomes. So, recognition of importance. The timely recognition of stroke symptoms is vital as it directly influences treatment options and recovery. So, this means early intervention can reduce the amount of brain damage, whereas being late or acting late or too late can increase the risk of having severe brain damage. Everyone should be educated on the signs and symptoms of stroke to ensure that they can respond quickly and effectively. Risk factors. High blood pressure is the most critical risk factor for a stroke, like I mentioned earlier. It makes your blood vessels more thin and it allows it to be able to burst or rupture. Exercise, medication, and a healthy diet is essential in reducing stroke risk and making sure to maintain a healthy blood pressure level. Diabetes. Diabetes significantly increases the risk of a stroke. High blood sugar levels can damage blood vessels and nerves, contributing to the development of cardiovascular issues. The proper management of diabetes through medication, diet, and regular monitoring can help mitigate stroke risk. Smoking. Smoking can double the risk of a stroke by increasing the changes of blood clot formation, which in turn blocks the blood flow towards the brain. So smoking actually damages the lining of your blood vessels, making them more likely to rupture, like I mentioned. So smoking increases blood pressure and lowers your oxygen supply. Obesity. Obesity leads to high blood pressure, which is a leading cause of stroke as well as plaque buildup in the arteries that restrict and block blood flow to the brain. So obesity plays a role in increasing the risk of type 2 diabetes and heart disease. Blood vessels are damaged due to the inflammation caused by high cholesterol and make a stroke more likely to happen. Now, family history and genetics. So, family history does play a part in this. Health conditions that increase stroke risk, such as high blood pressure, heart disease, or diabetes, they may exist within your family through your parents or your siblings, whether they had it genetically from their parents or you are predisposed to having this. So, if your parents or sibling has had a stroke at a young age, your chances of a stroke are higher due to the shared genes or lifestyles. Now, it's impossible to change family history. However, it is possible to manage lifestyle to reduce the risk of a stroke. Let's move on to diagnosis. So, CT scan or an MRI, detailed imaging of the brain to show if a stroke has occurred, as well as determine what type of stroke it is, whether it is an ischemic stroke or a hemorrhagic stroke, as well as the severity of the stroke. So CT scan is the first test done because out of the two is the fastest, and it shows quick images of the brain and signs of the stroke. On the other hand, an MRI creates a detailed image of brain tissue to detect smaller strokes or strokes that occurred hours or days earlier. Blood and heart tests. So for blood tests, they check your blood sugar, clotting time, as well as infection. Heart tests, they identify sources of clots like atrial fibrillation. Treatment. So treatment for an ischemic stroke, there is a treatment called clot busting medication or TPA. So the way this works, uh, the blood clots are dissolved through a medication and helping restore blood flow and limit the brain damage. This medication must be given within 3 to 4.5 hours after the stroke symptoms begin. And this is important, 3 to 4.5 hours after the symptoms begin. Another treatment is mechanical clot removal. So a device that physically removes blood clot from a blocked brain artery. This is usually done for large clots and larger brain arteries, and it is the most effective within 6 to 24 hours of stroke symptoms. Now for hemorrhagic strokes. Surgery is done to stop the bleeding and reduce pressure and prevent any further brain damage, as well as causing any more health risk. So rehabilitation is the second treatment. So recovery for individuals to help regain as much bodily function as possible. Could be walking, talking, and other daily activities. Rehabilitation can take some time. It could be months, or sometimes there's cases where it would take years for people to fully recover and adjust to either the new lifestyle. Let's talk about the long-term effects of stroke. The long-term effects of stroke include paralysis or weakness, which often affect one side of the body. People may often deal with speech problems, which can occur oftentimes periodically, or it could be uh, something that happens every so often. This includes difficulty speaking, reading, or writing. And victims of stroke also suffer from memory and cognitive issues, often having trouble thinking or remembering. People can also experience emotional changes such as depression, anger, or even anxiety. Daily tasks become a challenge, and victims will require help with eating, dressing, or bathing. These are some preventive medicines for stroke and TIA. So, after an ischemic stroke or TIA, medicines can lower the risk of another stroke. Antiplatelet drugs, these reduce blood clotting by making platelets less sticky. Aspirin is the most common and given mostly to patients. Some may take aspirin and clopidogrel, Plavix, or just clopidogrel if aspirin isn't suitable. Ticagrelor or Brilinta is another option. Anticoagulants or blood thinners. Heparin is used short term in hospitals, while warfarin is used longer term and requires regular blood tests. Newer anticoagulants like dabigatran or rivaroxaban, apixaban, and edoxaban act faster. They need less monitoring and have a lower risk of bleeding than warfarin. Now, let's talk about the prevention strategies to help you prevent having a stroke or reduce the risk of having a stroke. Lifestyle changes. So, if you lead an unhealthy lifestyle, implementing a healthy lifestyle change is a vital strategy for stroke prevention. This could include maintaining a healthy weight, engaging in regular physical activity, managing stress levels, and avoiding tobacco use. These adjustments can significantly reduce risk factors associated with stroke. Unhealthy lifestyle choices, like I mentioned, smoking, excessive alcohol consumption, and physical inactivity are well documented risk factors for stroke. So, encouraging healthy habits like regular exercise, a balanced diet, and smoking cessation is crucial in preventing a stroke. Nutritional guidelines. Adopting a healthy diet is essential for stroke prevention. So, following dietary guidelines such as the DASH dietary approaches to stop hypertension or Mediterranean diets emphasizes fruits, vegetables, whole grains, lean proteins, and healthy fats while limiting salt, saturated fats, and sugars. Medication management. For individuals at high risk of stroke, proper medication management is crucial. This may include antihypertensive medications to control blood pressure, anti-diabetic medications to manage blood sugar levels, and anticoagulants or antiplatelet agents to prevent blood clot formation. Stroke and nutrition. Now let's talk about stroke and how nutrition relates to stroke. So, relation of stroke and nutrition. So, nutrition plays a role in the topic of stroke, from how a poor diet can increase the risk of having a stroke, to how a healthy, balanced nutritional diet can help prevent and decrease the chances of stroke. A healthy diet can reduce a person's high blood pressure and cholesterol level. Limiting and reducing sodium can prevent high blood pressure as well. Important foods such as fruits, veggies, whole grains, lean proteins, in healthy amounts can help prevent a stroke. And drinking enough water, making sure to stay hydrated and support a healthy heart and brain health, and avoiding unhealthy foods such as processed meats, fried foods, and sugar drinks also help. Conclusion. So overall, stroke is a serious but preventable medical condition. Understanding its types, causes, symptoms, and risk factors empowers individuals to take the proactive steps necessary towards prevention and early intervention. By adopting healthy lifestyle choices, recognizing early warning signs, and managing medical conditions effectively, the risk of a stroke can be significantly reduced and prevented. So these are some questions I prepared. First off, what preventive medicines can be used for stroke and TIA? The answers are antiplatelet drugs and anticoagulants. So antiplatelet drugs, as I meant, all the answers and questions here have been gone over in the slides. So as I was saying, antiplatelet drugs, they reduce blood clotting by making platelets less sticky, and aspirin is the most common one. So blood thinners such as heparin is used short term in hospitals, while warfarin is used longer term and requires regular blood tests. Question number 2. What are the two types of stroke? The answers are ischemic and hemorrhagic. An ischemic stroke is caused by a blocked blood vessel, and a hemorrhagic stroke is caused by bleeding in or around the brain due to a ruptured blood vessel. Question number 3. What treatments can be done for ischemic stroke? The answers are clot busting medication must be given within 3 to 4.5 hours of symptoms showing, and mechanical clot removal, which removes the clot inside the brain. Now, what is the FAST method? Question number 4. The FAST method is an acronym meaning face drooping, arm weakness, speech difficulty, and time to call 911. What are some risk factors? High blood pressure, diabetes, smoking, obesity, and family history. That's my presentation. And to wrap it up, I would like to show my references / works cited page. It can be found in the end of my presentation. And thank you for listening.